Ladies and gentlemen, we have the honor and pleasure to present an invention from Poland that enables dentists to work safely in the condition of a global COVID-19 pandemic. For this reason, it is necessary to actively protect dentists against microbial threats, especially the deadly SARS-CoV-2 virus. The severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2 was first identified in Wuhan, China in December 2019. On the 11th of March 2020, the World Health Organization declared a worldwide pandemic. 2.5 months later, on the 27th of May 2020, over 5.5 million cases and over 350,000 deaths were recorded. After another 7 weeks, on the 17th of July 2020, these numbers have already reached over 15,100,000 cases and over 620,000 deaths. After 71 days of the pandemic, it turned out to be the most dangerous in the history, at least since the beginning of the second half of the 20th century. It is dentists who are most at risk of infection among physicians. If a patient is not infected, the problem does not exist. If it happens that the patient is ill with COVID-19 and the dentist is not adequately protected, the adverse phenomena quickly intensify. As the dentist can see 1,000 or even up to 50 people a day, a week before the symptoms of the disease appear, it may lead to infection of several hundred or even more than 1,000 people. In extreme cases, the dentist may overpay it with the loss of his or her life. Of course, such a threat must not be allowed. Everything must be done to make the bioaerosol containing various microorganisms, including various bacteria and viruses like COVID-19 coronavirus. Aerosol particles, including those inhaled when the patient breathes, float in the air, and if they are larger and heavier, they settle on the surface of various objects, or even more. They are dangerous and require hierarchical security strategy and the use of various personal protection measures known as STOP, because they are systematic, technical, organizational, and personal. We have illustrated these viruses as a horde of hostile and attacking creatures. Their invasion raises many difficult questions. How to fight against them? How to protect dentists from them? Is it a good idea to introduce special protective clothing? Perhaps, but it's hard to move in them. It's hard to be precise in movements. Conclusion, it's not a good idea. They certainly won't catch on in practice. We have to look for other solutions. We should change the way of thinking completely. The basis of this approach was the idea of our patent on accessory for personal protection of dental staff against SARS-CoV-2 coronavirus and other pathogenic microorganisms. The patent was developed at the Medical and Dental Engineering Center for Research, Design and Production at Sklepios Ltd. in Gliwice, Poland. First team consists of scientists, engineers and dentists. In order to protect medical personnel during procedures performed in the patient's oral cavity, it is necessary to remodel the current way of thinking. It is about keeping the maximum number of microorganisms in patient's oral cavity, eliminating falling and floating particles, air filtration and decontamination after treatments. The whole complex system of virus filtration, inactivation and decontamination is introduced. A part of the entire system is the face cap, the patient's mask, which causes negative pressure around the patient's mouth and nose and allows for the aspiration of bioaerosol inhaled by the patient. The face cap and the suction aspiration of the patient's saliva and blood residues are respectively connected by tubing to settling tanks. In those tanks, the aerosol inhaled by the patient condense and bacteria and viruses are destroyed by chemical disinfection. The aerosol precleaned of microorganisms is then exposed to ultraviolet radiation, filtrated with the activated carbon and sucked by a suction pump that provides negative pressure through the system to direct the purified air to the next filtration and then to the atmosphere. The system of devices and oxygen cylinders is mounted in the integrated moving housing in the treatment room. Thanks to the negative pressure, the face cap allows the sucking of coronavirus from the patient's breath and prevents them from spreading through the dental office. It is important that this cap is placed very close to the patient's mouth and the solution then protects the dentist effectively. If it is moved away from the patient's aeronasal space, even by 5 to 7 centimeters, it becomes little or completely ineffective. The face caps can be closed or open at the bottom, and various subsequent variants are constructed on their basis. The headband with the nose cap and eye protection, oral widening added saliva extractor and blood, added headband for saliva extractor and oxygen cannula are added subsequently to provide various possible functions of this device. 19 possible constructional and technological variants of this device are protected by the patent. The device enables the elimination of harmful bioaerosol generated by the patient as a result of breathing in the area adjacent to the patient's mouth and nose, for example, directly at the source, or reduces the concentration of this bioaerosol in the air as much as possible. The tubes discharging harmful bioaerosol from the patient's mouth have a partially open cross-section similar to the letter C. Manufacturing by milling requires 16 to 20 times more material than additive manufacturing by stereolithography (SLA). The obvious features of the entire system include the elimination of harmful bioaerosol with coronavirus directly at the source. The resulting benefits include the possibility of performing all types of dental, surgical, and anesthetic procedures with a very effective elimination of epidemiological risk. Because of the effectiveness of the dentist protection system against coronavirus infection during medical activity, we recommend the solution covered by the patent to all dental clinics. We do hope that this will enable dentists to work normally and safely without fear of COVID-19 coronavirus contamination and provide patients with proper dental care, despite the utterly remarkable times.